Welcome to Safari Veterinary Care Centers, where your pet's health and comfort are our top priorities. At Safari Veterinary, we offer a comprehensive range of surgical services performed by our skilled and compassionate team of veterinarians and support staff. This dog has a large mass on the top of its neck area. The dog has already been pre-medicated earlier this morning, and a 4 catheter was placed at that time. Once the dog was brought into the surgery suite, an induction agent was administered to facilitate the placement of an endotracheal tube. The endotracheal tube delivers a mixture of oxygen and the anesthetic gas isoflurane to the lungs. The pet is now in a surgical anesthetic mode, with complete monitoring of heart rate, blood pressure, respiratory rate, depth of anesthesia, and circulatory rate. Intravenous fluids are being administered to maintain kidney and liver function, support circulation, and provide emergency vein access if needed. The surgical preparation begins with shaving the area in a neat and precise manner, creating a perfect square around the tumor. The pet is then repositioned on the table as per the surgeon's instructions for access to the surgical site. The surgical pack contains the instruments that will be used, including hemostats, various types of scissors, retractors, and sponge gauze. The surgeon organizes these instruments for easy and quick access. The surgeon opens the surgical pack and places a sterile drape over the area to create a sterile surgical field. The surgeon dons sterile gown, gloves, mask, and hat to prevent contamination of the area. The mass is elevated and the skin is incised. The tissue underneath the tumor is then bluntly dissected by inserting instruments and spreading them open to identify blood vessels, nerves, and other structures beneath the tumor. These structures are either cut, dissected, or ligated and removed as necessary. Once the tumor is removed, it will be sent for analysis to determine if this tissue type poses an additional threat to the pet. In many cases prior to such surgeries, X-rays of the lungs and abdomen are performed to check for any spread from the tumor to these tissues. The surgical site is closed in multiple layers. The cavity left by the tumor has a tendency to fill with fluid, so the surgeon takes time to close this dead space. Absorbable suture materials are used initially, which the body will gradually absorb over a period of 3 to 6 weeks. Once the dead space is closed, the fatty tissues within the subcutaneous area are approximated. At this stage, the skin may appear bunched and uneven, but skilled suturing can align and approximate the skin edges for optimal closure. The skin has a tough collagen layer just under the epidermis, which is used to achieve a skin-to-skin closure using a careful subcuticular suture technique. The outer layer of the epidermis is then sutured with external sutures that will need to be removed later. The surgeon takes a sample of the mass for submission to the laboratory. Throughout this process, the pet is monitored by the technical staff while it is cleaned and prepared. The anesthetic gases are turned off, but oxygen flow and monitoring continue for a period of time in the surgery room. The cuff of the endotracheal tube is deflated, and the pet is moved to the recovery area so that the surgery room can be prepared for the next patient. A technician monitors the pet, which still has its endotracheal tube in place. An AMBU bag is used occasionally to assist the pet's breathing. As the pet recovers and regains the ability to swallow, the endotracheal tube is removed. Once the pet can maintain itself in a sternal position, it can return to its cage. Throughout the recovery process, our dedicated team ensures the pet's comfort and well-being. At Safari Veterinary Care Centers, we strive for excellence in every procedure, ensuring your pet receives compassionate care and optimal treatment. For advanced veterinary care you can trust, visit Safari Veterinary Care Centers. Learn more at www.safarivet.com or schedule an appointment today.